We have a rural healthcare crisis here in North Carolina, and there's good news and there's bad news. The good news is that everyone on the right, the left, the middle, all basically agrees that this is a big problem. And a good place to start with this is understanding why rural North Carolina has a healthcare crisis in the first place. For the last 15 or 20 years, North Carolina's rural hospitals and clinics have kept going out of business, one after another. And it's not just the hospitals, it's also smaller facilities like the 5 regional clinics down east that ECU closed down just 2 years ago. By contrast, if you go to Charlotte or the Triangle or the Triad, you can throw a rock in any random direction and hit 6 different healthcare facilities without even trying. The reason this is happening is the economics of healthcare. We do not have universal healthcare in the United States, so when you go see a doctor, you've got to pay for that doctor's time and their training and the tests and the facility and all that stuff. And if you live in an area full of people with good jobs, with good health insurance, that's not usually a problem, but unfortunately, rural North Carolina is not like that. Rural counties in North Carolina have much higher levels of poverty and many more people on public assistance. Most rural county economies are stagnant or shrinking, and a lot of their populations are shrinking as well as people either move out or die. And this is not new. This has been happening for 20 years or more. Those of us from a rural background know exactly what this looks like, and it's not pretty. The reason why those rural hospitals and clinics are closing is because there just aren't enough people in their communities who can cover the bills. Medicaid expansion was a partial solution to this problem, but we didn't adopt Medicaid expansion here in North Carolina until 2023, and now that expansion is probably coming to an end, which means the closures will start up again. And there are other problems too, like many rural communities have a hard time recruiting enough doctors and nurses to come live and practice there, partially because those doctors and nurses just want to live in Charlotte or Greensboro instead, and partially because they're highly trained professionals, they like making money, and you can just make a lot more money practicing in a suburb. So what do we do? Remember I said there was good news and bad news? Read the bad news part. I'm an optimist by nature, but to be honest, I don't see the situation getting much better, and the fundamental reason is the politics. Rural voters are experiencing this ongoing deterioration of their healthcare system, but it has not affected their voting choices. They keep voting year in, year out for the very same politicians who are actively making their healthcare worse. That is a political choice, and not everyone agrees with it or even understands it, but it is their right to make it. The political will to rebuild rural North Carolina's healthcare system has to start in rural communities themselves, and we are just not seeing that yet. Voting has consequences. That is democracy, and the people will choose the future they want.